C-type natriuretic peptide analogue therapy in children with achondroplasia. Achondroplasia is a rare type of genetic bone disorder. It causes strong, flexible tissue, called cartilage, not to become bone normally. Now we will see a video about achondroplasia.
Achondroplasia. What is achondroplasia? A means without, chondro refers to cartilage, and plasia means growth. So this is basically impaired cartilage growth or proliferation. This is a common cause of dwarfism. And as you may notice from this picture, these individuals have a normal head and a normal trunk. And the reason that this occurs is, if you may recall from embryology, there are two types of bone formation. Intramembranous bone formation, this is not affected. However, you may notice in these individuals that their extremities are shorter. They are not developed properly. This is due to impaired endochondral cartilage bone formation. These individuals have an activating mutation on the fibroblast growth factor receptor 3. So the FGFR3 is increased in expression, so you have too much of this receptor on the cell surface. And what your body does is it responds by saying, hey, you're giving too much of a growth signal, so they're going to inhibit growth. So growth is going to be inhibited. Achondroplasia tends to be sporadic. It has an autosomal dominant inheritance pattern. Fertility, lifespan, and mental function are not affected in these individuals. So they have normal fertility, lifespan, and mental function. The incidence of achondroplasia increases with increased paternal age. So looking at this x-ray, we notice that the long bones have not developed properly. And the reason that these long bones don't develop properly is because the main mechanisms that long bones grow is due to endochondral bone formation. In summary, achondroplasia refers to impaired cartilage proliferation that inhibits growth plate and long bone formation, and these individuals end up with short extremities. However, their head and trunk are normal. And the mutation is an overexpression of FGFR receptor 3. It is an overexpression of FGFR3 that leads to inhibition of growth.
Nursing care. As the children with achondroplasia to be treated have heart pathologies, the following warning signs should be observed: anguish, confusion, fatigue, cyanosis, pallor, cold skin. Peptides natriuretics type C. CMP is a 22 amino acid polypeptide neurohormone, structurally similar to the other natriuretic peptides. The mechanical strength that circulating blood produces in the endothelium is the main mechanism inducing its release. And what is your function? It's a vasodilator and has antiprophylactic effects on smooth muscle, exercising its actions preferably at local level. Now we will see a video about the natriuretic peptides.
So natriuretic peptides are a hormone that's produced by the heart when it feels under some pressure. This can be pressure from things such as high blood pressure or diabetes. It does not mean that you have heart disease. It's a very early indicator of possible heart disease. Therefore, it helps us identify people who would benefit from intensive management of risk factors such as cholesterol and diabetes and blood pressure, and also from certain medications. The hormones come in two types that we can test for in the laboratory. One is called B-type natriuretic peptide, or BNP, and the second is called NT-proBNP. These are essentially the same hormone, but two different types of measurements that the lab does. The levels for each hormone are different, so you can't compare both together. So if looking at your own level, make sure you know whether it is a BNP or an NT-proBNP test that you have had tested.
Benefits. At the vascular level, they reduce peripheral vascular resistance, leading to a decreased blood pressure, capillary permeability, and vasodilatation, and have an antiprophylactic action on vascular smooth muscle, which that produce a remodeling, a process to which the function also contribute anti-hypertrophic of the peptides, leading to the reduction of the size of the cells on the vascular endothelium. Against the release of CPN caused by acetylcholine activates the CPN receptor in vascular smooth muscle width. Coupled to the G protein, it promotes hyperpolarization. Now, a video about natriuretic peptides in primary care.
So I think in the future, another area where we can expect to see NT-proBNP used substantially is in the primary care setting for earlier detection of structural heart disease and identification of heart failure at even earlier stages. We know very well that in symptomatic patients, NT-proBNP is valuable. So in primary care, just as in the hands of specialists, recognizing heart failure may be quite challenging, and so use of NT-proBNP is already supported in this setting. However, I'd emphasize that the processes that lead to heart failure, the heart muscle changes, the various cardiac abnormalities that lead to heart failure, may occur well before symptoms develop. And it is now known that NT-proBNP values in these patients are typically abnormal well before symptoms start. So ultimately, it may be possible to recognize the signature of heart failure before it even develops symptomatically and intervene at an even earlier stage. Ultimately, these are studies that need to be done in the primary care setting. We know, for example, in a pilot study called the Pontiac study, that early diagnosis of heart failure in patients with diabetes without symptoms, treated more aggressively, these patients did better in the NT-proBNP strategy versus a strategy without NT-proBNP evaluation. We're now performing the Pontiac 2 study where patients with diabetes will have an NT-proBNP measured, and if above 125 picograms per milliliter, these patients will be treated more aggressively with the hope that we can reduce new onset heart failure in these patients.
Conclusion. Natriuretic peptides are used to treat cardiac arrhythmias, which is a sign of achondroplasia in children. They have shown good results in animals and human studies. The nursing staff must take special care with these patients since they will suffer from other pathologies. Now, the last video.
A dwarf is a person of short stature, under 4 feet 10 inches as an adult. More than 200 different conditions can cause dwarfism. A single type, called achondroplasia, causes about 70% of all dwarfism. Achondroplasia is a genetic condition that affects about 1 in 15,000 to 1 in 40,000 people. It makes your arms and legs short in comparison to your head and trunk. Other genetic conditions, kidney disease and problems with metabolism or hormones can also cause short stature. Dwarfism itself is not a disease. However, there is a greater risk of some health problems. With proper medical care, most people with dwarfism have active lives and live as long as other people.
Thank you for your attention. I hope you enjoyed this video. See you soon.